Good morning. My name is Hans Kluge. I am the Director of the Division of Health Systems and Public Health at the WHO Regional Office for Europe, based in Copenhagen. And I would like to thank the organizers of the Bellagio event, particularly Professor Ghaffar and Professor David Bishai, and of course, the Assistant Director General of WHO, Dr. Maripol Kini, for giving me this great opportunity to participate in the meeting, and before that, run you through a number of slides on the European experience in the field of public health and the essential public health operations. Let me acknowledge also the input of my colleagues, Anna Tchaikovska and Martin Kraaij van Kroos of the public health team. So, the WHO-led effort to create the essential public health operations happened in the wake of the dissolution of the Soviet Union and the disarray of the public health services. The whole idea was to assist the new health system planners in achieving a minimum level of public health services, understood as fundamental and indispensable for meeting the public health goals and defining public health. We had a number of successive versions of the essential public health operations in 2007, 2012 and 2014, with a number of recurrent challenges. The length and the level of detail, as we say, the soup is served either too hot or too cold, and the trick was to find it just right. So not too detailed, but still comprehensive enough to provide a tool to the countries on what constitutes public health from an operational point of view. Ultimately, it's about putting the different bits and pieces of the puzzle together. The latest iteration of the essential public health operations in Europe happened in 2014, and it was the cornerstone of, in fact, two regional initiatives. The first one, and you see the cover page at the upper right corner, of the European Health Policy Health 2020, and an essential implementation pillar of the European Health Policy Health 2020 was the European Action Plan to strengthen public health. In fact, the Health 2020 is European health policy providing guidance to the member states on what constitutes, from a regional perspective, the biggest challenges in health and public health in the region, and what are the main strategic policy directions to tackle those. And what we see is that the majority of the 53 member states in the European region have now adopted national health plans and strategies in line with the values and the guidance of the Health 2020, of which, as I was mentioning, a cornerstone is the European Action Plan for strengthening public health capacities and services. This slide gives you an overview of the 10 essential public health operations. In fact, we call them the essential public health operations to distinguish a bit from the so-called health system functions. The vision is sustainable health and well-being. So this shows at once the paradigm shift from a disease-oriented focus to a focus on health and well-being. And we divided them into three main blocks. At the left, you see the so-called essential public health operations from an intelligence point of view, surveillance, monitoring, preparedness for response, and informing health assessments. In the middle, the service delivery, essential public health operations, health promotion, health protection, and disease prevention. And at the right, the so-called enabler essential public health operations, the governance, the public health workforce, funding, communication, and research. We turned all of this into a so-called country self-assessment tool, which is a tool which helps the countries to get a state-of-the-art of their public health services according to the 10 essential public health operations. We have it updated. You see the link here, and we're very happy that we have it both in English and in Russian. This self-assessment tool was piloted years ago, particularly in the southeastern European health network countries, but meanwhile many more countries have applied this tool both in the European Union countries, East and Southern Europe, and also the eastern part of the region. Recently we went a step further. We worked on a package of resource packages in order to standardize and quality assure this self-assessment. Because this is the weakness and the strength of a country self-assessment. The strength is that it is country-owned, the leadership is really with the country, but as we know, for example, from the assessments on the international health regulations, it is a bit difficult to standardize and to, let's say, having objective assessments, right? Because it depends on the scores given by the country itself. In any case, we have now a planning and preparation package to support the role of the coordinators of the essential public health operations self-assessment process in country in preparing the self-assessment. Second package is what we call a kickstart package to support again the coordinators of this process in country throughout the data gathering and the analysis phase of the assessment process, also covering the activities involved in launching the process of the essential public health operation assessment. And finally, a conclusion and dissemination package which takes the coordinators throughout the finalization and follow-up phase of the assessment process. Here you see a number of countries which used the latest version of the country self-assessment tool. The assessment takes 3 to 6 months. It involves about 50 to 60 professionals and average 10 to 20 institutions. The biggest plus, I would say, is the participatory process. This is a very strong point, but then of course it takes 3 to 6 months. And there are a number of ministers of health who, when they come into mandate, they would like to have a process which is more, I would say, quick and dirty, which is much quicker, right? But generally there is a very positive feedback. 2 examples is that in Macedonia, for example, this EPHO self-assessment formed the basic for strategic public health reforms, and in Poland, this included the first major public health act. So it's the key issue, obviously, is not the self-assessment, but is really the follow-up. Some of the added values: empowered leadership, improved personal relations and professional networks, the increased institutionalization of public health, and integrated capacity building. What are some of the keys to turning the essential public health operation assessment into policy implementation? What are the necessary foundations for a successful assessment? It's the integration into an explicit reform process, national ownership, and the availability of technical expertise. Further, to achieve the goals, a shared understanding what public health services entail, and to articulate prioritize recommendations. This is key. In fact, this is not only for the public health, because you come up with a whole list of recommendations, and of course the country needs to prioritize. Ultimately, and ideally, we come to a development and implementation of evidence-based public health reforms. The more ownership you create from the beginning, the more chances that you achieve these evidence-based public health reforms based on the assessments. We developed a number of additional support materials. At the left you see the policy brief addressing the needs in the public health workforce in Europe. This relates to EPHO number 7. And at the right you see the cover page of the evidence summary, the case for investment in public health, which is EPHO 8. There are many more which are at our website. We also felt the need to take a big step further in linking the essential public health functions and the health system strengthening with the international health regulations. This is the initiative led by WHO globally, and the Assistant Director General Marie-Paul Kinney asked us here in WHO Copenhagen in Europe to convene a meeting in March in Copenhagen with the 6 regions, WHO headquarters, and a number of WHO representatives, so linking the 3 levels of the organization on a first brainstorming on how to go about much more linking the public health, the health system agenda, and ultimately the universal health coverage agenda to assist our colleagues in WHO and the member states in a better implementation of the international health regulations. At the regional committee this year in September, I presented with the regional director the midterm progress report of the European Action Plan to Strengthen Public Health 2012-2020. This is a midterm report looking to the past, but particularly to the future on how the member states implemented the European Action Plan to Strengthen Public Health and what are some of the lessons learned. We have a document on this, but I'm highlighting 5 points. Many important achievements in strengthening public health services happened, which in large were catalyzed by the adoption of the European Action Plan to Strengthen Public Health in 2012. So we can say that European Action Plan was a catalyzer. However, the overall visibility of the plan in the countries somehow has been too low. It was stuck a bit at the level of the Ministry of Health, but did not reach all the stakeholders. And there are many, as we know, in the countries. There is a gap, a big gap between, at one hand, the stated level of political commitment. So countries and Ministry of Health are telling, yes, public health is very important. It provides the key to better health and well-being in the future, and it's very cost effective. But between this stated political commitment, there is a gap with the actual allocation of the budget. And the evidence on the high cost effectiveness of the public health interventions is still not broadly known. We have a lot of evidence. I'm showcasing at the right the policy brief where we pulled together the case for investing in public health, a lot of convincing and powerful evidence, but then as a public health community, we still fail to communicate this to the higher level, not only to the Minister of Health, but particularly to the Minister of Finance, to the Prime Minister. So we need to do some critical thinking why it is that when we have so much evidence in this field, we still do not succeed apparently to convey this powerful evidence. The member states agreed at the Regional Committee on the way forward of the European Action Plan to Strengthen Public Health for WHO and the countries to work on what we call the enablers of public health services, working in partnership. So instead of trying to be all-encompassing and move forward in similar energy and resources on the 10 EPHOs, there was now a consensus that we will focus for the next 4 years on the enablers. It means the financing, the public health legislation, the public health workforce, and the organizational models of the delivery of public health services and the governance. For this, we are now in the process of identifying with the partners an agenda for action, meaning what are the priorities that the partners can really help us to assist the member states. We are, together with countries, selecting a number of so-called champion countries, countries which are leading in public health and which are willing and enthusiastic to share their experience and also provide some resources, and then doing this together, of course, with a number of partners. This is the agenda for action that we will discuss with the partners in January in 2017 and then with some member states in March 2017. I'm not going to go through all the details, but it gives you a little bit of an idea on what are the future activities and where are we going to put our limited resources into the priorities and the work plan. For example, the public health workforce, one of the outcomes, the objectives would be that the public health workforce is recognized and valued as a profession. For the time being, we see that in our countries, there is a lot of resources and recognition to clinical professions. And of course, this somehow is understandable because there's very, very powerful constituencies behind the clinical care. Patient organizations, some of them in fact financed also by the pharmaceutical industry. There is the whole pharmaceutical and technology sector behind, then clinicians themselves, the hospital sector. So these are very powerful constituencies, plus the clinical professions are quite marketable in high-income countries, which then gives us another challenge, namely the migration of the profession. If you look at the public health workforce, we do not have such a powerful constituencies. And in addition, if we as a public health community are doing a good job, it means that nothing is happening. But if we do a bad job, then there are outbreaks and crises. So mainly we are getting known to the broad public if something goes wrong. So we have to do some critical thinking. And a good example is in the United Kingdom, where the government is ring-fencing a budget for public health. And ring-fencing budgets for public health, we know that this is one of the most effective and efficient ways to beef up the role of public health. This is going a little bit more into detail. One example of an action within the objective 1 on leadership for public health, a high-level dialogue on leading transformational change for public health service delivery. Not just another course on leadership, but really giving people the skills and knowledge to make a transformational change. And for this, we have a very powerful network of ex-Ministers of Health, ex-Chief Medical Officers, who in a very free and frank way are sharing what were the obstacles and also enablers that they faced when they were in the formal position of a minister or chief medical officer in making this transformation on public health. Dear colleagues, we are very pleased on behalf of the Regional Director, Dr. Susanne Jacob, to be part of this fantastic meeting in Bellagio. Better public health means better public health and well-being, and better efficiencies, which again is a case that we have the evidence, but we need to politically communicate this to the Minister of Finance and Prime Ministers. We have a lot of experience in this office now. We have a lot of policy dialogues with Minister of Finance, Minister of Health, Prime Ministers under the umbrella of the Health 2020. And in a very modest way, I am really looking forward to share this experience and to learn a lot from this senior audience that Professor Bishai and Professor Ghaffar and Dr. Maripolkini are convening. Thank you very much, and my full commitment. Have a nice day.